Thank you, Richard, and thanks for the opportunity to come today, and thanks for the work that you guys do when you're not here. Last night, Dr. Batten was talking about stories and how powerful stories are, and she was talking about her story, but she was also talking about the stories that everybody has, and all of you have stories. I was diagnosed with Burkett's lymphoma December 12th of 2012. I'll remember that day. A year ago tomorrow, I was in a dark room at the Nebraska Medical Center, getting ready for a PET scan to find out if the cancer had gone away or not. Now, I don't know if any of you have had PET scans before, but they inject you with a radioactive, I don't exactly know the physics of it. There's some sort of physics that goes along with this. But glucose solution, and you sit in the dark room because your body is taking up the glucose, and then the PET scanner causes some sort of gamma rays to be released. I don't know, I'm not a particle physicist. But what happens is then you can find out what are the parts of your body that are active. Cancer cells and tumor cells, tumors are more active, and so those light up. But they want you to be in a dark room because your brain uses 25% of the body's glucose, and it turns out that thinking about whether your test is going to be positive or negative looks just about the same as a metastasis to your brain. So I was sitting there trying to be calm so it wouldn't look like I had a brain tumor, and thinking this is kind of a weird situation. That was a year ago tomorrow. So actually I was there at this time of day. It was a Friday morning last year. And I would be thinking probably about this even if I wasn't talking to you because it's a year since then. I'll fast forward a few hours. I met with my doctor. He said everything was clear. And that was a huge relief for my wife and I. So I'd like to just tell you a little bit about some of the things that happened in the hopes that that will be helpful in forwarding this discussion as patients, as teachers. When I got sick, Burkett's lymphoma, which I had never heard of before, it's very common in Africa, not so much here, is a very fast-growing lymphoma, doubles in size every 25 hours. And so I had probably been sick just for a week or two, or had cancer growing in my body, and the Saturday after Thanksgiving, I started noticing I was at a sushi restaurant, and I didn't want to eat any sushi, and I love sushi, and that was a weird thing. But my mother had been in town. She had had some sort of stomach flu. My son had had it, and the neighbor kid across the alley had had it. I figured that's what it was, and the next day we went to cut down a Christmas tree, but I laid on the bed and watched them decorate the tree. And I figured, again, I was just sick. It took about a week to find out that I had tumors in my belly. One of the reasons it took longer is that the people that recommended that I have a CT scan, I didn't listen to because, like Dr. Pizzo, I had been well and healthy all of my life, and so I was thinking to myself, Western medicine, what do they know? I'm a Western medicine physician. But in the role of patient, I have a different perspective about Western medicine than in the role of a physician. But finally, my doctor said, you need to have a CT scan. And I went there, and then I was laying there waiting for the results, and I was waiting for a long time. And I asked the nurse, kept saying, when are they going to tell me the results? And finally she said, well, your doctor's going to come in and tell you the results. In my doctor-patient communication class, we have one lecture on how do you break bad news to somebody. I'm like, oh no, I know what this means. Tell her she doesn't have to come, that's fine. Dr. Allegre also teaches in the class. It's very nice. She talks about death and dying to the UMKC medical students. But she came in and she told us the news, and then we looked over the shoulder of the radiologist who showed us the slides, the CT scan. Poor guy, I think he probably went into radiologist so he wouldn't have to do things like that, and now suddenly he's having to do that. I had a biopsy. The biopsy got sent off to the Mayo Clinic, and it took a few days before that came back. And I was getting sicker and sicker. I had seen my oncologist in Lawrence, where I live, and we needed to have a definitive diagnosis to know what kind of treatment regimen to do. And I finally got a call on Wednesday of the next week, about 4 or 5 days later, saying, you have Burkett's lymphoma. So and she had talked about Omaha as having a very good lymphoma treatment program. They've been in research for 30 years in lymphoma treatment. And so she said, you're going to be getting a call from the doctor from Omaha. And so he called a few minutes later, and he said, well, you're going to need to come to Omaha for treatment. I said, okay, it's only, not too far away. When do I need to come? He said, well, we have a bed waiting for you now. That was 8:30 at night, so at 9:30, my wife and I got in the car and drove north. And I remember driving up I-29 and just watching every mile marker because I wasn't sure I was going to make it. I just felt really terrible. I had enough energy, though, to be able to tell my wife how she wasn't driving correctly. She was too far to the left, too far to the right. Should I set the cruise control? That was all my energy was going into trying to control the one thing I might still have control over. But I got there, and they were very wonderful. Checked me in. Now, one of the things that I found in Omaha was that, there was a whole team of people that was working with me. I was on the special care, oncology, hematology special care unit because they were doing high-dose chemotherapy. So I would have 100 hours of chemotherapy over a 5-day period, and then go home for 16 days, and then come back for another 100 hours of chemotherapy. And so they want to make sure you don't die while they're giving you the chemotherapy. And it can be a weird experience if you've had chemotherapy before. So one of the regimens had 3 agents. They'd hung a IV bag for 24 hours, but this was a 96-hour infusion, so every 24 hours they'd have to change it. But they'd come in and they'd put on these gowns and gloves and masks, because if they got a drop of the chemotherapy on them, it would really harm them. And yet the whole bag of it was running into my body. And I was wondering, why is this a good idea? And they explained that they actually didn't know why it doesn't hurt you on the inside when it could hurt you on the outside. But it was very effective. And so there were these weird experiences like that. And one of the things that happened was after the first round of chemotherapy, I found myself not wanting to go back. And I was wondering to myself, why is that, I mean, I could think of different reasons. But I talked to a therapist that I consult with, and she was talking about that a dog trainer had been at her house that day, and the dog trainer was talking about, if you want to train a dog not to eat food off your counter, the best way is to give them food that is spoiled and that makes them sick, because there's a very instinctive reaction not to return to something that would make you sick. And so I realized that I was having that kind of reaction. I felt like the chemotherapy made me really sick. On the other hand, my brain knew it was really helping me and it was going to keep me alive. But the rest of me said, run, don't do this. This is terrible. It's poison. It will burn you if it gets on your skin. Don't let them put it inside of you anymore. Fortunately, I'd been reading Peter Levine's work. He's a guy that his latest book is called In an Unspoken Voice, How the Body Releases Trauma. And one of the things that he talks about is visceral reactions. And when something bad happens, you can have a real visceral sense of it. And I realized, I'm having a visceral reaction to this chemotherapy. And in his book, he talks some about how to let yourself release that. And I had also a body worker that I worked with that helped with that process too. But I was able to release that feeling, and then I could go with what my head was telling me, going back up to Omaha and do this again. But if I had not been able to do that, I think that it would have been really a challenge to go there, or even if I was there, that it would have had such ambivalence that I think that would have caused me problems. Same thing happened when my hair fell out. I was in the shower and washing my hair, and suddenly it was all coming out of my hands, and I had this real visceral reaction to that, like feeling like I was a mangy dog or something. I mean, just in my gut, felt sick. And by this time I was getting, you know, a little better at recognizing that. And I talked to my wife. I called her and said, you know, I'm really feeling bad about this. And she held me for about a minute. I cried for 45 seconds, and it was gone. It passed through me. So one of the lessons that I learned was that we can have visceral reactions to different kinds of health situations. And if we're able to release them, that can be helpful. But if we don't, then it can be really staying with us. In terms of, I know somebody was asking about spiritual care, and one of the things that I do as a spiritual practice is something called the Avatar course, which is a spiritual development course. And they were having their sort of annual retreat between the 3rd and 4th rounds of my chemotherapy. It was a 13-day retreat, and it fit right in the 16 days that I would be at home. And so I talked to my doctor. I said, you know, you guys are doing amazing things for me physically, but I would really like to be able to do this for myself spiritually. He wasn't sure about it, but he was, you know, he just wanted to see how I was doing. And that was fine. But then there was a physician's assistant that worked with him that was named Mark. And I talked with him about it, and he said, yes, you know, let's see if you can go there. He said, that's what we're keeping you alive for, so that you can do what things in your life are important to you. That was so powerful to me, because I don't think about that very often. What are we keeping people alive for? And what are you staying alive for was such a powerful question for me. And then the team rallied around and were able to help me to get to Florida. I made it through. Dr. Akhtari was one of the physicians, and he had been thinking about it. He came back after rounds one day later in the afternoon and said, I was thinking about you today, and I thought, here's something you can do. You can go, you know, make sure you get a wheelchair when you go to the airport so you can go through security faster. Oh, that was really good, because I needed to conserve my energy. And then another thing that happened was then after the 4th round is that my blood counts really dropped, and I got a fever. And and this happened in the middle of the night. It was about 2 in the morning. I woke up, I had vomited, and I had a fever of 102 point something. And I knew what to do, because in Omaha they'd given me a little card that says, you know, if this happens, you know, go to the emergency room and give them this card. But I couldn't find the card. And so I was looking for it, and my wife, I think she had been told if he doesn't get to the hospital in 10 minutes, he could die. So I'm looking for the card, and she's trying to get me in the car, but my hemoglobin had gone from 14 down to 7, and so I didn't have enough brain power to say, I'm looking for the card. All I could do was look for it. And luckily, I found it within a minute or two, and we were able to get there. So another lesson was that it would have been really helpful to know that at the moment when you're most going to need help, your brain is going to be